Have you ever heard of the story of the crotchety old man, that the older that they get, the more cranky that they get? Well, you see this in men and you see it to a large degree in women. So you know what ends up happening is our hormones decline. It does have an effect on the brain. When you do analysis of the brain, you're going to find out that there's many receptors for hormones in the brain tissue. And when you have lower hormones, obviously those receptors aren't triggered as frequently and you get less effect of that hormone on the brain. And there is an absolute link between mental health, stability, enjoyment of life, and all of the things associated with a happy life and a comfortable brain that occur when you have hormonal decline. So yes, hormones are directly related to mental health, stability, anxiety, depression, irritability, and crankiness. So it's out there, it's proven, it's in the literature, there's no question about it. So when we prescribe testosterone for men and women, many times we see dramatic increases in improvement in their mental health and stability. These people feel happier, they're more engaged, they're more enjoyable in their life, they enjoy their activities, they have more motivation to go to the gym. All of the things that many people used to think were because, oh, I'm getting old, I just don't feel like doing it anymore. No, some of it may be directly tied to the level of hormones in your body. So if you think you're having some mental instability or decline or depression or anxiety that you can't really put your finger on, you've worked really hard, made a nice living, got a couple dollars in the bank, and you're going, I'm at the prime of my life, I should be having fun, it just doesn't make sense. Well, maybe, just maybe, that's hormonally driven, and by correcting your hormones and balancing them to an optimal level, you can see a dramatic change in your life. Trust me. I've been doing this for over 15 years and I've seen it time after time after time. In fact, my staff is instructed specifically to pay attention to the cranky patients that we have that come in the beginning because it may be hormonal, and you'd be surprised at the dramatic change you see in 4, 6, 8, 10 weeks. When we get there on their treatment plans, how different they are as people, how much more enjoyable that they are. So if your family, your friends, or anybody, or even yourself have been noticing these type of changes in the way that you feel or interact with your life, you may be having a hormonal decline. So this is Dr. John Carrozzella from the Florida Center for Hormones and Wellness. We know all about this. We see it every day, as I mentioned. If you have any questions, drop us a line. We'd be happy to answer them. Put a note in on this video down at the bottom. We'll see if we can get to it. And by all means, if you feel that hormones are right for you, or at least want to even just ask the questions to us that we can answer for you, we'd be happy to make an appointment for you in our office. Take care.